Definitely the complexity has evolved, right? The early days, a lot of times when we do data science or AI, even with traditional analytics, it's more focused on structured data, right? We ask questions about, hey, how often is it a duplicate, or how often it is wrong or inconsistent, right? But I think AI and just the availability of data has changed. The conversation has shifted to yes, and do we have all the information we need to get the right context of the situation, right? There's a lot more contextual completeness conversation going on, right? To your point, AJ, right? Like, yes, we have the records of the patient in front of us, but is it the right one for the question we're trying to answer, and tends to come up more and more often.
I, I I agree completely. I think the data that we're using has changed in its complexity. I think the biggest change has been obviously in the last couple of years, the democratization of AI. Like, when we were starting, we were working with highly specialist stakeholders who understood the challenges of data to a certain extent. They kind of had the battle scars and they were kind of looking to AI to solve in some part. That was a relatively niche part of a healthcare organization. Now you have essentially anyone can can in theory develop and deliver and execute an AI pilot really well, because the tools at our disposal are much higher. I think the questions and the pitfalls are the same in many ways as they were before. Now there's just a much larger kind of cohort of people who are experiencing them. I think probably the other thing to point out is, because of this democratization and the type of AI that we now have, it's not just data quality that's important, it's AI quality. In the past, if AI made mistakes, I guess in some way we could kind of figure out where those were coming from with novel techniques around generative AI, around hallucinations. The quality of data being produced by the AI is now a question, and we have this really important task to ensure that not only the data in is not garbage, as you were saying, but actually the data out has kind of quality frameworks around it to ensure that it itself can be trusted, particularly I think in clinical applications.
Yeah, I was here.
Put a pin in that because I want to dig more in that. Go ahead, Ivana.
No, I was just going to say, I agree wholeheartedly. I mean, especially in clinical use cases, really trusting that the output coming out of these models is accurate is paramount. I mean, and you see now the application of AI being used further away from the patient, but as we get closer and closer to being a fundamental part of patient care, really understanding the traceability and auditability of the decision that was made through the AI. So it is absolutely a part of making sure that the data is good, garbage in, garbage out, but that you have some knowledge, a knowledge layer, whether it's you're augmenting the AI or you're tuning the AI with some level of knowledge to validate the output in a way that can really trust what is coming out of it is critical.